Are officially recording, and I hope you guys are doing all right. Can you believe it's week 8? I honestly, I think I'm still writing 2019 when I write the dates, and 2021. I think they were hoping for big things there this year, but let's shoot for 2022, shall we? And the hopefully there you guys have had a chance there to look at the week 8 PowerPoint, and nothing too crazy there. The title of it is we're kind of moving towards people, because ultimately, that's the whole point of this course. We learn microbiology and all these kinds of things to ward off infections from microorganisms to protect people. And that's where I kind of like to move my science, because there has to be a reason why we're learning about mitochondria and cell membranes and antibiotics and all these kinds of things. So the if you haven't had a chance to look at the announcements there from this past week, please know there that like last week's class there, I asked if there was any objections there to me changing quiz 2 from week 9 to week 10. And I gave you guys a week and I didn't hear anything, and so I hope it's all right. The syllabus has been changed, and I think it gives you guys a better understanding of the test, because the quiz and the test will be the same. I like the format of everything there for quiz 1, test 1, but your feedback is everything. You guys are the eyes and ears on the ground, and we'll reduce the number of questions and reduce the number of time. But I do kind of like the flexible format. I've never been a fan of an hour test, stress, these kinds of things. So that's the plan. And Monica, thank you. You agree? That's what I need to hear. Okay. And honestly, I'll don't ever think that you can't ask a question. Don't ever think that maybe your question is silly or look, all questions are good. All of your feedback is good. Even positive feedback, even negative feedback. Tell me if something didn't work, and tell me if something did work, because then I'll utilize that. Because education is dynamic, right? It's expanding. Opposite of expanding is decreasing. There you go. Deflating. It's that's education, and education changes for the times. And like when my parents were kids, when your parents were kids, books were the medium. Read a book, stick your nose in a book. And I think books are awesome. I still like books, but you have to think education has changed. And here we are right now. We're not even in the same room, but this is week 8. And so you guys are doing great. If there's any issues, let me know. But other than that, quiz 2 will be week 10. Okay, it'll follow the same pattern. And for anyone who's just joining, I hit a new button there when I created your Zoom link, so that you guys are all muted upon entry. And but if you guys do have any questions, do let me know. And you know what I mean? We're only here for an hour or so. You guys have all week to ask questions. Let me know. Keep me going. So just let me know if there's any issues, but I don't anticipate any issues. So quiz 2 will go ahead week 10. So we have next week's class, and then after that we have anatomy physiology in an hour and a half. And then your quiz 2 will open. There'll be enough time, okay, to deal with things there. And then your test 2 will be the week 11. And then we have class week 12 and 13. And then we have final test there, 14. That's it, man. That is it. Okay. So that's the plan. I hope you guys are doing okay. Can you guys unmute yourselves? Do you guys have any questions at all? And if you don't have any questions, it's all right. I'll post the video there to YouTube afterwards. I'll shoot you guys the link. But other than that, I hope you guys are doing really well. Okay. And for the test one, there were a number of you who emailed me about questions there. You guys saw the email. I think I deleted 2 questions there from the test. It happens all the time. It happens all the time. Okay, so oh no, I don't want to cancel our Zoom meeting. Why did that come up? Okay, but canceling questions, it happens here and there. And if there's by some chance I didn't reply to somebody, let me know, please, because I think I got everybody there who had questions and all that. But other than that, keep me posted. I think you guys are doing great. And other than that, Ian, I'll shut up and get to class, shall we? Yes. The quiz will close the same day. Carolina, thank you for the question. The quiz, it'll open week 10 at 9 o'clock. And I'm assuming there that if I reduce the number of questions, I think there that we can do the quiz in one day. And you know what I mean? So you guys will always have enough time to do your quizzes and tests. I'm not a big fan of stressful tests where you have a 1 minute a question. Well, what if question 53 takes you 2 minutes? Does that mean that you don't get to answer question 78? No. You guys will all have enough time to do your quiz and your test. So this isn't a speed test. I don't judge one person's grade against another. You are all geniuses, and I love it. Okay? No, good question. Hey, Carolina, that's how you get answers. And as far as a definitive answer goes, I don't have a definitive answer. I'm making your test and quiz now, and it takes me a week or so to do. And I'll let you guys know there next week what's going on, but you guys will have enough time for sure. Okay? Good questions. Thank you. Let's rock and roll, shall we? Perfect. Okay, so we are recording. We are good to go. And welcome to week 8. And I updated the, I always do that, right? I make my PowerPoint there and I send it to you guys there, hopefully with some time for you guys to actually read it. And then I'll usually the day before I go in and I update it. And so this PowerPoint's been a little updated, nothing serious at all. I'll give it to you guys there afterwards, okay? But there's 2 parts to this here. There's part A, surgical asepsis and principles of sterile technique. Okay, and then there's a part B, which we kind of, there's kind of a hodgepodge of stuff. We're going to talk a little bit about surgical procedures and the OR, the operating room. Okay, something called a surgeon's preference card, case carts, and emergency codes. And I thought that this was an appropriate title here, moving towards people. And because the whole point of this course is to save human lives, and most importantly, your life. Yeah, your life. And in preserving your own life, hopefully there will be an effect of saving other people's lives as well. And all of this, you're going to see a shift now. We are moving towards, people and applying your microbial knowledge. And maybe you think that you haven't gathered any microbial knowledge over the past 8 weeks, but you have. And that's the thing with education. That's the thing with learning, is you are absolutely 100% no more intelligent than the day you started my course. And I mean that from the bottom of my heart. You are just as intelligent as you are now as you were then. It's just that you guys, not me, you guys have investigated, have read, have watched videos. You guys have done this. You know what I mean? And it's brilliant. You guys are just utilizing skills there that you guys have already possessed. Okay? And I think you guys are doing great. And that's where we're moving there in this direction, moving towards people. There has to be the human phenomena behind all of this. Okay, and and this PowerPoint here, I need to say I am not a surgeon. Okay, I have been to medical school. All right, but I am not a surgeon. So as far as questions go, I have them. You'll see there that I've updated the PowerPoint. There's a lot more definitions, like little definition thingies. You'll see them there and all this kind of stuff. But ask as many questions as you can. I may have the answers. Most likely I'll have the answers. And if I don't, and I'm only one person, there's no way that I could have all of your answers. But what I can do is I'll find out your answer and get back to you. Okay, so please ask during the week. Okay, ask as many questions, because I know a lot of you guys, and hopefully there you guys do. You guys go back and watch this video there later on in the week. Maybe you're not even here right now. Maybe it's Thursday and you didn't get a chance to watch this video last Saturday, and that kind of a thing. Okay, so yeah, very good. So there's a lot of things going on here, but we're kind of taking our microbial knowledge and we're moving it somewhere, and we're moving it to a hospital setting. And who lives in hospitals? Yeah, bacteria do. Sure they do. Yeah, there's lots of bacteria in a hospital. But people, that's what we're doing. Okay, so we are moving forward. I haven't heard anything from anybody, so I hope I didn't like mute you guys the whole lecture. But if you guys have any questions, just throw it in the chat and I'll get it there in a bit. And when I was making this PowerPoint here, I don't make these PowerPoints to be like a slideshow. Okay, because I find that this little square that they give you for the slideshow is kind of too small. And like, if you ever get a chance to come and be in my class, whenever they do have classes, I think colleges across the province are moving towards more of an in-house presence for the colleges, universities there for next semester. So, you know, if you ever in one of my classes, you'll see there that, you know, I try and use as much space as possible, because and everyone goes towards their strengths, right? And my learning style is more spatial. You know, I think that we're all visual learners there to some degree. So the best way to view my PowerPoints, I guess I should have told you guys this there week 1. I'm telling you guys now week 8. Thank you very much, Ian. The best way to view these PowerPoint is like in open view like this. Okay, I don't know. That's just me. Yeah. Okay, so I'm going to show you guys some links. There's going to be, we're going to watch a video and all these kinds of things. So like, let's begin. Some of these slides, I apologize for a little wordiness, but they do tend to make sense, and I'll actually tell you where I got these words from. In healthcare, hospitals mandate effective and safe infection prevention and control practices, but ultimately, they are everyone's responsibility, because we must protect each other, right? We have to. And who is everyone? Who is each other? Patients, healthcare personnel, families, you know, all these kinds of things, right? It's everybody. Everybody means everyone. Okay. Last week there we covered the principles of routine prevention and control practices. Okay. And the use of additional precautions and personal protective equipment like PPE. We talked about it, but we didn't talk about it because we actually talked about it there. I think it was week 2. Okay, but we did do some PPE. And we talked about there the PPE to control and prevent the spread of infection. In acute, there's 2 words there that deal with severity or length of severity of an infection. There you've got acute, and I'm just going to so you've got acute, and then you've got chronic. Chronic is long-term. It's a long-term illness. deadly. Acute illnesses tend to be short-term and not lethal, but they can turn into be chronic. But acute means short-term, chronic means long-term, right? So, but today we will explore surgical asepsis. There's some definitions there we want you guys to know. Principles of sterile technique, and some procedures related to sterile techniques in the OR. Okay? And we're going to talk about surgery. And, there are different severities or different levels of surgery, right? There's day surgery, there's open heart surgery. We'll get into some of these. And by any means, am I a surgeon? No. Okay? But we're having some fun here. Good. Part A, surgical asepsis and principles of sterile technique. Sterile. The asepsis definition, okay, refers to the absence of infectious material or infection. So this means that there isn't any bugs on, this particular scalpel or whatever, right? Surgical asepsis is the absence of all microorganisms with any type of invasive procedure. That's the whole thing there with surgery, okay? And one of the definition of what surgery is, you're basically breaking the skin. And the skin is the only thing stopping bugs from getting in, right? It's basically kind of like we're covered in a corn husk. A corn husk is, it's rough, it's dry. That's what our skin is, right? And if you remove that, that's why there's such a thing as a burn unit in a hospital, because somebody gets a 2nd or 3rd degree burn. Okay, that the epidermis has been removed. Okay, and now you've got an open door. Okay, so that's surgical asepsis. Sterile technique is a set of specific practices and procedures performed to make equipment and areas free from all microorganisms and to maintain that sterility. It's no good just to make something sterile. If this is going to be used, it has to be maintained as sterile. And I was digging around, and I use this all the time, and you'll see there it's OpenText BC, and it's based out of British Columbia. And honestly, it's not new for me, but I guess it's kind of new in the past 10 years that information, you shouldn't have to pay for information. And it's just the way of the world here that education is a huge moneymaker. Okay? And here we are. You know what I mean? You guys paid the money for the course. You're in the course, and hi, I'm your teacher. And I hate the fact that people have to pay for information. I think information is free. Knowledge is power. And only if you have money can you acquire knowledge? To me, it goes against every moral fiber I have. Okay, and hopefully you guys know this link already. If you do not, you will have it right now. Okay, and this is OpenText BC, and this is an open source learning, and I'm not going to go into it, all right, but you guys have the link there in the PowerPoint, and you guys can have a look at all of this. Like, there are thousands of books, all these kinds of things here. I'm not going to go into it. I just found this right here, and you guys can have a read. I'm going to refer to these links there all through today's PowerPoint there. There's the OR environment, all these kind. And I encourage you guys to visit this site. There's another one there called OpenStax, OpenStax, OpenStax. And I think is it based out of Harvard University or one of the big Ivy League schools there down in the States. And like why do you have to pay to learn? If I have a student who wants to learn, wow, then that is the gift in itself. And if somebody wants to learn, here's as many books, here's as many websites, here you go and learn however you want to learn. And it's free, it's great, have a dig, and it's just great reading. And if this isn't your cup of tea, there's a million other books and courses there that y'all can take. So there's OpenText BC, and another one there called OpenStax. But you'll see there that a lot of stuff there from today is going to come from this site. It's great. It really, really is. Okay, so that's have a look there. I'm not going to spend too much time on it because your time is precious, and I don't want you guys kicking around here forever. So, all right. So there's the asepsis, surgical asepsis, and sterile techniques. Okay, good. These sterile techniques, we use them mainly for the OR, operating room, labor and delivery rooms. Okay, very important. Babies coming out of utero with basically zero immune system. Okay, and it's got to be sterile. Crazy. There are some special procedures there. We'll talk about some of them. Okay, diagnostic areas, doing biopsies, these kinds of things, examination rooms. You know what I mean? That's where we want to try and, if you've ever been to a dermatologist, basically every little office in a dermatological setting is an operating room because the doc will come in and let's say you got a mole to be removed. Well, we're not going to, they're not going to have a surgery room here. They're just going to, some of them do. You look at Dr. Pimple Popper and all these kinds of things, right? But basically, a room can be an office, can be a surgical area. All depends on your needs. We'll talk about more like that there later. Commonly practiced when performing a sterile procedure at a bedside. See, even at the bedside can be a surgical area. Such as inserting devices in the sterile area of the body. We'll talk more about this. Catheter, okay, central venous lines, okay, an IV. These kinds of things. You're breaking the skin, right? In the healthcare there, the sterile techniques is always used when the integrity of the skin is accessed, impaired, or broken. Okay. Sterile techniques can be as something as simple as putting on gloves, sterile gown, or autoclaving their sterile equipment. So that's where we're in this area there all day. Okay, we'll be here, we'll be there, we'll be around, but this is our backyard there for today. Okay. You guys will remember this there. Okay, hospital-acquired infection, HAI. Well, there's another one there, SSI, okay? And people get these hospital-acquired infections there, from other patients, and, you're in the same room, you get an infection, right, from somebody else. Well, here's another one. You get an infection from having surgery. And there's a reason why there's an acronym SSI, because it's happened before and it'll happen again. All right. The sterile technique is essential to help prevent surgical site infections. SSI, surgical site infections. These are unintended and preventable complications arising from surgery. And we've all heard the joke there that the surgeon left the forceps inside the patient, or the surgeon left the sponge inside the patient, right? No, we don't want to do that. Surgical site infections are defined as an infection that occurs after surgery in the area of surgery. Okay? And the whole idea there with this common practice, it happens all the time there, like cosmetic surgery, elective surgery, plastic surgery, these kinds of things, right? People get breast implants or something like that, and if there's some issue there, you will know pretty fast, within a day or so, if there's an infection or not. Okay? Inflammation, red, pus, these kinds of things. Lots of pain. Okay? So, SSIs. Principles of surgical asepsis. Okay? These principles here, they must strictly be applied to all personnel involved, okay, in an aseptic procedure. So it's just not you and patient. It's you, patient, equipment, and anyone else around in the room, because you know what? We're all sharing the same air. Right? Okay? And just... and I want it to be clear, all persons involved in an aseptic procedure. Well, you've got the people performing the procedure, i.e. the surgeon, okay? People assisting the procedure, okay? Nurses, however, anesthesiologists, these kinds of things, right? Even people intervening. And here's something there that we don't really take into account, okay? Maybe something goes wrong within the middle of a surgery. Now we got to bring in our anesthesiologist, or we got to bring in, something. Maybe there was a blood spill or something. We need to bring in somebody to clean up a mess. Okay, that person there has got to be scrubbed down, right? And probably more important, I'm just going to read this again in all its totality here. The principles of surgical asepsis must strictly apply to all personnel involved in an aseptic procedure, performing, assisting, or intervening. And also, which is probably more important, you should know when these procedures have been breached or broken. Okay, you have your set of procedures, which I'll show you guys. There's a nice little video there. And you have your sterile field, you have your principles of surgical asepsis in place. It's good to know them, but it's also good to know what kind of situations will cause a breach, because we don't want a breach in our sterile field. We don't want, you know what I mean? And it's good for people to know, but it's also good for people to know when things have been broken as well. Because if something is cracked, it's as good as broken, right? All right, you don't want to be driving on tires that are cracked. All right. Yeah, I put this in there. Not knowing is not an excuse. Okay. And anyone that's involved in a hospital setting, basically, to do any job in a hospital setting, you got to sign. And why do you sign? Because your job's on the line. If there's an issue with the job that you just did, they're going to come back to you on it. It's accountability, right? It's people don't want to take responsibility for someone else's actions, and you know what? They shouldn't have to. All right? So, not knowing is not an excuse. And if you're currently in a hospital situation where of employment there, please consult your hospital administrator about do's and don'ts, principles of surgical asepsis, all these kinds of things. All right, because every hospital will have a different procedure. Hope you guys are doing all right. You guys are awfully quiet. I hope you guys asked to unmute. If you guys need to get on or ask me a question, let me know. I hope you guys are doing well. And again, hand hygiene, blah, blah, blah. We've been here 1,000 times, and you know, we're probably going to talk about it 1,000 times before the end of the course. Anyway, hand hygiene is a priority. That's first and foremost. You know, wearing a mask and hand hygiene. Like, that's 99% of everything, right? When performing a procedure, ensure the patient understands how to prevent contamination. You need to explain to the patient, okay? And, you know what I mean? You may be an anesthesiologist, you may be a doctor, you may be a nurse, you may be just an MDR and medical device reprocessing, person. That's your job, okay? But in any type of a situation, you are the trained professional in a hospital setting. The patient is not. and you can't expect them to know what you know. So if you are in a position of power, okay, educate. Knowledge is free. Tell the patient there what their role is. If their role is just to sit there, be quiet, put your unroll your sleeve, okay, then that's what they need to do. Okay. Yeah, because you're trying to hook an IV up and you got a needle and you're trying to find that vein, and all of a sudden they're on their phone, they're laughing, sneezing, all these kinds of things. Well, it's gonna cause more trouble than not, right? You're gonna choose the appropriate PPE. Of course you are. All right. You're going to review the hospital procedures and requirements for sterile technique prior to anything. Okay? Prior to starting any type of invasive procedure. Healthcare providers who are ill, okay, you should avoid, if you got COVID or something like this, you shouldn't be performing surgery at the moment. Okay? And that's what we got there. This is really good, and I'm gonna go back to this website here, and you'll see that what we're doing is we're gonna be talking about there are 10 principles of sterile technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and I was I made these up there, and they're just wonderful slides. There's not even a picture. Horrible teacher, Ian. And there's no way that I could actually convey these 10 rules of principle of sterile technique without this video here. So this video here is awesome. And this is Thompson Rivers University here, Open Learning. Again, this is, my vision, that you should be able to learn anything. Okay, pay $20 to take a test. But learning should be free. Books should be free. There shouldn't be any type of limit on what you guys want to learn here. And this is really good. Have a look. Play with this website. It's all good.
Hi, my name is Renee Anderson, and this video is about the principles of surgical asepsis. We've set up...
This video is really good. And please credit Thompson Rivers University. I think they're awesome. And this video this shows you everything.
A sterile field for you with a dressing kit to help these principles make sense.
What happened to my internet? There we go. It's those kids on Netflix downstairs. All right, if I can't play this, I don't know what's going on with my internet. Wonderful. Okay, well, anyway, we don't have to watch this anyway. You guys can watch this. And you'll see here that, actually this is kind of all we need right here, is she talks about what's called a sterile field. And for some reason my internet's not playing here. I don't know what's going on. But you'll see here that you've got this sterile tissue here, that you unfolded and you lay it down, okay? And in theory, it's all sterile. But then there's a border along that she is labeled off in marker. Anything there that's basically touching the sides, we consider to be not sterile. And you have to think, sterile is not clean. We're not talking about clean here. Clean, there is an acceptable level of dirtiness involved in the definition of clean. You see, like this coffee here, okay, it's, the cup was clean. I don't think it was sterile. It went through my dishwasher. My dishwasher is not rated to, an autoclave style, sterile infection, so my cup was clean, kind of dirty now, but there's my mouth bacteria in there. This is clean for me. See? I'm going to make it. I'm not going to die. But sterile is not clean. Sterile is the absence of any type of bugs. And I encourage you guys, please, you have to watch this video. That's how good it is. And it's just at the bedside, and it takes you on the maintenance of maintaining a sterile field. And you'll see there that you got your tweezers here, you got these guys here, and you'll notice where they are within the sterile field. You know, if you anything on the edge is considered quote unquote dirty. All right, so the handles where you're going to touch this, they stay on the outside, and anything on the inside here, this is all sterile, and you want to maintain that sterile field. Okay, and the sterile field extends upward, by the way. Okay, you don't want to be hovering a peanut butter sandwich over top of your sterile field. All right, so your sterile field isn't just a two-dimensional piece of paper. Your sterile field is three-dimensional and extends up. Okay, you don't want to be hanging your head and scratching your head over top of your sterile field, because then your sterile field is gone. Okay, so please, 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 100%, you must watch this video. Okay, I don't know what's wrong with my internet. It's wonderful. I hope you guys are getting it. But even if you guys aren't getting it, if my internet seems to be crashing out, I don't know. I wouldn't know why. But I'm still recording this, so I will post this there to YouTube anyway. Okay? So going through all of these here, first and foremost, all objects used in a sterile field must be sterile. Whew. Boy, does that just gives me a headache. Commercially packaged sterile supplies are marked as sterile. You know what I mean? Gauzes, swabs, these kinds of things. You know, even Q-tips there, all these kinds of things, they're advertised as sterile. Okay? Because we put Q-tips in our ears and nose and these kinds of things, right? And like gauzes and all these, they'll be in a package, right? And you'll open up the package and you'll, like, if you want to get gauze, you know, maybe your patient there, you know, you got your sterile field there and you need some gauze. Well, you open it up. You don't even touch it. You kind of throw it. Sorry, I'm kind of doing this with my hands. You open up the package and you kind of dump the gauze into the middle of your sterile field. Yeah, because as soon as you touch it, it's not going to be sterile anymore. But if you just open it up, don't even touch it, and kind of dump it in there, it's sterile. You want to check the packages there for expiry dates. Okay, very important. Okay, make sure there's no punctures or to the package there, over dryness, any torn previously open. You remember, if anything is suspect on its sterility, if you don't know if this is 100% sterile, consider it not. And another thing there, when you watch the video, the whole idea of eyesight. You know, let's say you're at a bedside and you're taking care of some stitches or something there for a patient or whatever, and there, you know, you have your sterile field. And if you don't know what I'm talking about, a sterile field, it's if the video there. Pause this and watch the video. It's your little sterile field with your border there that I just showed you there with the nurse practitioner there, okay? And just the whole idea of maintaining that, keeping that going, that's what we want there, okay? Eyesight, if something is out of eyesight, you cannot guarantee that it is sterile. So you have your sterile field there, you know, you have your tweezers and your forceps and your dressing and all these kinds of things. You have to maintain eyesight on all of these things at all time in order to guarantee that they are all sterile. Whew. Say that again. You can't let any of the equipment out of your sight. And the reason is, if something is out of your sight, that means you can't see it. Sorry if you can't see me here, you know. And then something from the ceiling can fall, a leaf, something can, these kinds of things. And that's what we want. You have to maintain sterility. If you lose line of sight with any of your equipment, then therefore now you can't guarantee that it's sterile and it all needs to be scrapped. Okay. Number 2, a sterile object becomes non-sterile when touched by a non-sterile object. Okay, that is true. You have a sterile tweezers, okay, and you touch them there to sterile, non-sterile glove. Well, you got to throw those tweezers away. They need to be reprocessed because now they are not sterile anymore. These are rules to be followed, okay, and they are in current practice at the moment, being done right now across Canada in the hospital. Okay, so when a sterile object touches a non-sterile object, they're both gone. Well, the sterile one's gone for sure. Whenever the sterility of an object is questionable, consider it non-sterile. Yes. Fluid flows in the direction of gravity. Keep the tips of forceps down during a sterile procedure to prevent fluid from traveling back up the forceps there into your finger or glove or anything like that, right? We want to keep the fluid moving down, if that is the case of your scenario, okay? Sterile math, principles of surgical asepsis here. A sterile object remains sterile only when touched by another sterile object. So if this piece of equipment is sterile and you touch it to this one here that you know is sterile and they've been in your line of sight and you know that no one else has touched them, that's key, eh? Again, if you turn your back and maybe somebody touches one of your pieces of equipment, you don't know which one, everything has got to be scrapped. It's a pain in the butt, you know? So that's why just maintaining that line of sight, you know exactly where your sterile field is. You know what's clean, you know what's sterile. Sorry, you don't know what's clean, you know what's sterile. Okay? Only because you've been watching this piece of equipment there for 3-4 minutes during your surgical procedure. Okay? So, sterile plus sterile is sterile. Whew! Crazy math. Sterile plus clean, contaminated. Sterile plus contaminated, contaminated. Sterile plus questionable, contaminated. Okay? And clean is a subjective word. Maybe your level of clean probably 100% surpasses my level of clean. Okay? And clean is a subjective word. All right? Sterile, there is no subjective nature about sterile. Sterile means 0 bugs. Clean does not. Number 3, sterile objects that are below the waist or items held below waist level are non-sterile. Automatically. And you watch the video there and you'll know what I mean. The video is great. It really is. And it takes you through everything. And you're working at your bedside table. You have your table here, okay? And, you know, the first thing you do, you'd spray the whole table down with alcohol. 99% alcohol. That's as good as you're going to get. Okay, you lay your tablecloth down. That's sterile. Put everything in there. But you'll see your table is at a certain level. Okay, and anything below that level is considered non-sterile. Okay. Keep all equipment and sterile gloves above the waist level. Table drapes are only sterile for waist level. So any part of the tablecloth that drapes down, you know, that part that drapes down there kind of underneath the table, if it gets, anything touches it, that thing that touched it is now contaminated. Okay. Number 4, sterile fields must always be kept in sight. Okay. we've just talked about that. You got to keep things, okay, and never lose track of them, because if the sanitariness, the cleanliness of an object is in question, it's got to go. And never turn your back on the sterile field. Number 5, when opening a sterile equipment and adding supplies to a sterile field, take care to avoid contamination. And so you've just put 5 minutes, 10 minutes in, and you've made this sterile field. Okay, you got your border along there and everything in there. Don't mess it up. Okay, because if you need more equipment, you are here. You're going to open packages, you're going to do all this, and you're going to put things into your sterile field. Don't break it. Don't breach it. Make sure that everything that enters the sterile field is sterile. Okay? And setting up sterile trays as close to the time of use as possible. Stay organized, complete procedures as soon as possible. Yeah, you don't want to be hanging around. You don't want to be suturing somebody's stitches and it takes 4 hours to do. No. Sterile objects can become non-sterile by prolonged exposure to airborne microorganisms, right? Like we all share the same air. Number 6, punctures, moisture, or tears, okay, to the packages. Keep sterile surfaces dry and replace if wet or torn. Holes in the wrapping paper, dust, these kinds of things, right? And once a sterile field is set up, border of 1 inch on the edge of the sterile drape is considered non-sterile. Okay, so that border we were talking about now, it's 1 inch. And 1 inch, what's that, 2.67 centimeters, somewhere in there? Okay, so about that much of the border is, you consider it non-sterile, because that border there is now in contact with the edge of the table. Okay? And place all objects inside the sterile field and away from the 1 inch border. The handles of your forceps or scissors or whatever, they kind of hang out right on the edge, the skirt there of the sterile field. Okay. If there is any doubt about the sterility of an object, non-sterile. We know that. Sterile persons or sterile objects may only contact sterile areas. Non-sterile persons or items contact only non-sterile areas. Okay, so this is where we got, right? The people are doing jobs. Surgeons, nursing, PSWs, support staff, administrators, janitors, you know what I mean? Everyone's got their own job and everyone has their own level of sterility needed, okay? And in a hospital setting, everyone's washing their hands 100 times a day, these kinds of things. But you got the nurse in there helping there with a post-op procedure. Okay, so they're right in the operating room there, or and they're doing something, as opposed to somebody walking down the hallway carrying papers or a mop and bucket, these kinds of things. So every job is different. Sterile persons doing sterile jobs, okay, they only come into contact with sterile things. People who are not, do not. And, you know what I mean? It's just kind of common sense. Do not place non-sterile objects in a sterile field. Don't bring dirty waste buckets in there to a surgical room. And if there's surgery going on, you can guarantee those garbage bins are clean as a whistle. Sterile as a whistle. Okay. Last one here, there for these techniques there. Movement around and in the sterile field must not compromise or contaminate. Okay? So, of course, we'll all have our masks on when we have a sterile field, but don't sneeze, cough, laugh, or even talk. Right? Because you're talking, you're spitting. There's no other way to do it. There's no other way to talk other than to micro-spit. And if you're talking over a sterile field, now you've just contaminated it. So you want to kind of step back a little bit here and talk over this way, kind of a thing. Of course, keep your hair tied back. Keep the OR traffic to a minimum. Door closed, and when pouring sterile solutions, It's a good little tip there in the video. I really like this one. Even if you have sterile solutions, I don't know if you're dealing with peroxide or alcohol or any of these, when you're unscrewing the cap, you have to think that the outside of the bottle that you're using, the cap, the bottle, even the lip of the mouth of the bottle, it's all dirty, right? It's all contaminated. You have to consider the inside of the bottle of whatever liquid you're dealing with there. We have to think that it's sterile, right? And so if you're going to use some of it, watch the technique there that the NP uses, okay? You take a little bit and you clean the edge of the mouth of the bottle before you dispense the liquid. Have a look at the video, watch what I mean, you'll see what I mean. It makes perfect sense. Makes perfect sense, right? Because these aren't routine practices there for daily life. These are routine practices there for a hospital. That's where we're at, okay? And that's that one there. That's part A, okay? And we're doing all right. We'll just keep on going. That's how this will go. Part B here, the learning objectives. We've got surgery. And again, I'm not a surgeon, okay? But we're going to kind of take a flat stone and throw it against the still water, right? And a smooth surface of a lake there. And we're just going to get a couple skips. So we're going to talk a little bit about surgery, some surgical procedures, okay? Types of ORs, and there's a lot of them, and I don't have them all, but I've given some examples, okay? Surgeon's preference card, case carts, and emergency codes. And I actually may have to take a little break. And you know what? It's been 52 minutes since class started, so let's take an 8-minute break. I'll see you guys back at 10 o'clock, and we'll finish up part B. How does that sound? And I'm kind of worried that I can't hear any of you. I'm going to see, can you guys unmute yourselves? I don't even know. Oh, there is chats there. Okay. No. Oh, okay. So, hi. Okay, I was so worried. I didn't know if I had cut all you guys off from me. But, okay, good. Yeah, take 7 or 8 minutes. I got to go take care of my son there, and we'll start up part B. Yeah.
Can I ask you a quick question?
Sure.
It's not for your class. What I want to ask you is, you know how when we finish a quiz or a test, right?
Okay.
You know how our course, our mark comes right up, like automatically?
It should.
When I was in Nikki's class, right? She also made us do definitions, and the computer can only mark true and false and multiple choice because it's one answer, right? So I'm assuming that she was checking it. So when I went in and I finished the test, it said needs grading. What is that supposed to mean?
I don't know. That sounds like a new one, but have you spoken to Nikki about it? Because if you did the test, like Blackboard is pretty good about recording stuff, and I can't imagine there that you. Are you asking me if the test the answers are there, or what it didn't mark it, or sorry, could you rephrase your question?
I'm pretty sure it's marked. It's just that, you know how when you finish, it should come up. The mark should come up automatically.
It should, unless.
I was wondering. Yeah. Because the definitions, wouldn't that be marked usually by the teacher? She didn't want to see it. Because I was thinking the whatever happens, the computer, it can't technically, because the definitions, people in the class, wouldn't people kind of say the definition in a different way? There's many different answers. So
yeah, that's with the thing with multiple choice is, you know what I mean, there's one answer. I don't know. Have you spoken to Nikki?
Not yet about it.
I would do that, and let me know, because Blackboard should be populating marks.
It said needs grading. It said needs grading, and I'm like, what?
I don't know if you guys have ever heard. There's a really, really great lab program, VR, virtual reality lab program. It's called Labster, Labster. And I use that for a lot of my courses, like especially during the pandemic. When you can have students do their labs from home in their jammies, and you have this great three-dimensional lab that you can do and answer questions about. But I've been having issues with that as well, as about marks being populated in my other courses. So, Jonathan, I wish I could be more help, but talk to Nikki and keep me posted on that, because I don't like to hear about problems other teachers are having, but it's just knowledge is power, right? And if Blackboard is giving another teacher an issue, then I would like to know about it, because I will encounter that issue. So Jonathan, please keep me posted on that, okay? And if you have any further issues, let me know, and I'll tackle it from my end, because I can get a hold of Seneca IT faster than you can, trust me. So okay, so it's 9:56. We'll see y'all back here at 10:05. That'll let me go take care of my son and refill the coffee. We'll see you guys back in 10. I'm going to keep this open. I'm going to stop the video, but I'm going to keep the Zoom open. I'm going to try anyway. So I'm going to mute it and turn the video off, but don't go anywhere. I'm watching you. Okay, I'll see you guys in 10. Now, I'm coming.